Hi, my name is Dorothy Casey. I'm a health consultant and a former chronic ovarian cyst sufferer. Before I introduce you to the exact natural solution that helped me overcome my recurring ovarian cysts, let's talk about ovarian cyst surgery. There are several ovarian cyst surgical procedures. They include diagnostic surgery, ovarian cyst removal surgery, as well as surgery performed to eliminate cancerous ovaries. Almost all of them are performed under full anesthesia with a multitude of monitors recording the pulse, heartbeat, blood pressure, and other vitally important medical data of the patient. Whenever a woman in the childbearing age complains of a nagging pain in the lower abdomen or experiences irregular periods, it could be because of cysts in the ovary. To substantiate the diagnosis, the patient is often asked to take a USG, which confirms the presence of cysts. Diagnostic laparoscopy at this stage can become quite helpful in identifying the nature of the cyst. As soon as the effect of the local anesthesia is fully felt, the surgeon selects an area immediately below the belly and punctures 2 pencil-thin holes in the abdomen. A narrow tube is next inserted into the abdomen through the other hole that holds a tiny video camera, a powerful light source, and some sensors. Laparoscopic surgery involves the use of a laparoscope, a device with inbuilt video camera and a powerful light for taking images of the ovary and transmitting them to a monitor before the surgeon. The procedure begins with the patient being placed under full anesthesia while the surgeon makes a few small incisions in the abdomen, right below the belly button. The surgeon then selects the appropriate instrument to scoop out the cyst from inside the ovary, and it is eventually removed from the abdomen. However, one of the biggest problems associated with laparoscopic removal involves its retrieval from the pelvic area without spilling. Since most cysts contain fluid as well as some solid material, there are 2 distinct problems at the final stage of the surgical procedure. In cases where the performing surgeon gets a feeling that one or both the ovaries have turned cancerous, the surgeon immediately goes for laparotomy, which provides much better field of vision for the surgeon to check the ovaries and remove them if necessary. Surgery should be considered when there is a clear danger from ovarian cysts. Having cancerous ovarian cysts is just one example. Whenever you undertake permanent, irreversible surgical procedures such as laparoscopy or laparotomy, you run the risk of irreversible infertility. That means you will not be able to have kids in the future. Beside the irreversible results that surgical procedures can cause, these procedures are also very expensive and most are not covered by your health insurance. Not to mention the serious complications that may result from such an invasive surgical procedure that also do not guarantee the complete prevention of future ovarian cysts. Now, what you must understand is that regardless of the symptoms you have, the cause or the type of your ovarian cysts, the only way to permanently cure ovarian cysts and prevent their recurrence and their potential complications is the holistic approach. Unlike the conventional medical approach, which tackles the symptoms of the disease by calming the pain or by removing the ovarian cyst itself, the holistic approach to healing uses 100% natural means to help the body restore its natural inner balance while tackling all the deep-rooted factors responsible for the formation of ovarian cysts. In this way, the holistic approach, safely and without any side effects, neutralizes the internal environment responsible for ovarian cyst formation. This is the only way to ensure permanent freedom from ovarian cysts and their related symptoms, alongside a healthy and balanced hormonal and reproductive system, mental clarity, and well-being. Now, as a former chronic ovarian cyst sufferer, I want to introduce you to the exact solution you've probably been searching for forever. The system I'm talking about is called Ovarian Cyst Miracle by Carol Foster. This is the only program that worked for me after years of suffering. This is a fast, simple, unique, and extremely effective 100% holistic 3-step system for eliminating ovarian cysts and PCOS for good by tackling the root cause of this condition. The ovarian cyst miracle system works regardless of your age or lifestyle. It works even if you have small or very large ovarian cysts, multiple ovarian cysts, follicular cysts, dermoid cysts, or endometrioma cysts. If you want to learn more about the Ovarian Cyst Miracle by Carol Foster, you're welcome to visit Carol's website by clicking on the link to your right or on the link which will appear at the end of this